Hi, everyone. My name is Emma Jackson. We're so excited to welcome you today to our workshop, Developing and Adapting a Statewide Evaluation System for the Rape Prevention and Education Program in California. We will refer to this program as RPE program moving forward in the presentation, so just wanted to point out that acronym. I'm a research manager at the UC San Diego Center on Gender Equity and Health, and we'll be moving to UC Berkeley in the future. And I'll pass it to Mina to introduce. Oh, and my pronouns are she, her.
Thanks, Emma. My name is Mina White, and I am with the California Department of Public Health with the Rape Prevention and Education Program. I am the basically evaluation research scientist, epidemiologist there at CDPH working on RPE. It's good to have you all here today. And then we also have Anna Lee, who will be part of this presentation. She's not here right now, but she's with the Center for the Pacific Asian Family. And I'll turn it over to Alina.
Hi, everyone. My name is Alina. I use they, she pronouns, and I'm a community educator for the Sacramento Unified School District, K-12 schools. And I'm here representing Weave from Sacramento.
All right, so before we get started, this work is sponsored by the California Department of Public Health's Rape Prevention and Education Program in the Injury and Violence Prevention Branch with funding from the Centers for Disease Control and Prevention, National Center for Injury Prevention and Control. So our workshop agenda for the day, we're going to spend about 30 minutes doing an overview of the California RPE evaluation system. Mina is going to lead us through that, and then we're going to hear from Anna Lee CPAF virtually and from Alina Mendoza about how these two community organizations are using the data collected from the RPE evaluation system to facilitate their RPE work. We'll then move into a session of roundtable discussions. We'll have two different topics of discussion. The first one moderated by Mina, which will be on this side of the room, and it will be focused on reflecting on the learnings from this RPE evaluation system and thinking about actionable items we can take forward into the future in the future iterations of this system. And the second discussion will be moderated by myself on this side of the room, and we are going to be talking about data equity and how to incorporate and embed data equity, anti-oppression, anti-racism into our data systems as we also move forward into the future iterations of the system. And then we'll do a 10-minute discussion share back where we can hear what the opposite sides of the rooms have talked about. And we will end discussing the future of RPE evaluation in California. Our workshop objectives for the day are number one, to identify the benefits and challenges of conducting a comprehensive evaluation across 24 RPE projects in California. Number two, to learn how to apply the California RPE evaluation system to sexual violence prevention projects in other parts of the nation. And number three, to explain how to use statewide evaluation system approach to promote health equity. All right, I'm going to pass it over to Mina to do an overview of our evaluation system.
Sure. Thank you, Emma. First, I guess, can I kind of take a little informal poll? How many of you are like RPE coordinators or evaluators or from like state level? Okay, so a lot of you. How many from like work at the local level on RPE and the RPE program? A couple. How many of you have never heard of the RPE program? And why are you here? No, okay. Okay, so I will go over some of the RPE just background, because if for those of you who have never heard of it or want to know more about it. So the RPE program is a national sexual violence prevention program funded by the CDC, the Centers for Disease Control and Prevention, and we California CDPH is a recipient of the RPE funding. And fund 24 subgrantees, subrecipients throughout the state to conduct sexual violence prevention in their local communities. So this cohort of our subgrantees that we're going to be talking about today that implemented this evaluation system they implement prevention efforts across California and in two different strategies, broadly categorized as school-based or community mobilization approaches. So this cohort that we're going to be talking about really is the first to implement the new statewide RPE evaluation system in California here for this, starting in 2019. So the first thing we did when we started developing this evaluation system was come up with a theory of change for RPE and how we expected to see the changes occurring with the RPE program. So the RPE grantees designed their programs with the intent to impact the risk and protective factors that we, based on doing a review of the literature and looking at the studies that were out there on sexual violence prevention. These are the ones that we theorized that were most effective to reduce sexual violence, and we outlined these in the theory of change. The RPE evaluation system, in turn, was really designed to measure these RPE program impacts on these risk and protective factors related to sexual violence. So you'll see here there's environmental factors, these broad categories of environmental, interpersonal, and individual level. And so at the environmental level, we really wanted to look at those structures in place for sexual violence prevention, and the perception of community safety. These are things that we included as measures in our evaluation. At the interpersonal level, there was social connectedness that we wanted to measure and social norms against sexual violence. And then at the individual level, those are the ones that we usually see most common, and are probably what is thought of as maybe the easiest ones to evaluate, looking at attitudes, beliefs, knowledge, and self-efficacy and behaviors around sexual violence prevention. Okay, well, the RPE evaluation system is a statewide data system that allows for the evaluation of the program impact on sexual violence and related risk factors at the state and the local level. The evaluation system is designed to standardize outcome evaluation across all the programs, which is something that we had never had before in California. This was something that, with the funding that began in 2019, we really wanted to apply some standardized measures, some standardized tools, so that all of our funded subgrantees could use some core measures that we could then compile and look at across California. So prior to this cohort, like I said, no standardized system to evaluate the RP programs existed, and most programs really conducted mainly just process evaluation. So this was a good way to look at process and outcome measures across the state. This is just a short little timeline to show our timeline of how we developed this evaluation system. In 2019, which was about when the funding started, we started planning and piloting the evaluation system. From about February 2019 to July 2020, we started implementing it. Unfortunately, around that time, there was COVID that happened. So that really, as I'm sure you all know, kind of threw evaluation for a loop as far, and even just implementation in general was disrupted. So, that meant things like we collected pre-surveys and we couldn't collect post-surveys. So that, those data were not super usable. So that really disrupted, really everything around implementation and evaluation. So we kind of pivoted and adjusted some of the tools after that. The evaluation system with, when schools, for example, were not able to meet in person, we shifted to having facilitators for RPE, ask them some qualitative questions to be able to get at some level of outcomes from the facilitator perspective. Even though they weren't, pre-post surveys, we were able to get some stories, some anecdotes, just something from like what they saw was happening in their communities. So we felt like that was sort of the level that we could expect to consistently get from all of our RP programs around the state. The changes that we made kind of within, in the midst of the pandemic and afterwards were really to, we took that opportunity to really look at the surveys more too and adjust them, since it was a time when it was in transition, and we thought, okay, we're not really implementing the surveys anymore. Let's like look at them again and see what works and what doesn't, and really make sure these surveys are working for everyone, since we're rolling out, in a kind of a new phase of RPE evaluation. So we made changes to improve the RPE evaluation system and made sure they're accessible to all of the communities that we were funding. And then now we're sort of, in the middle of sort of wrapping up some of the evaluation and collecting some final outcomes that will wrap up the last 5 years. So these are, I don't know if you can read that from the back of the room, it's kind of small, but this really shows some of the data collection that we implement as part of the RPE evaluation. You'll see on the left there, that lists the RPE qualitative outcome questions that I mentioned. And those really get at some community level outcomes and some participant level outcomes. Those are some of the questions like, what do you see as far as community changes related to RPE? Just kind of general questions that they can reflect back on what their RPE groups or what their participants are seeing, either in community or in the primary groups that they work with. Over on the top right, it lists RPE community level outcomes. We implement a monthly form for the RPE program where they're able to collect outcomes, community level outcomes, and process data. So that's something that they submit online every month. And those in that form will ask things like what did you change? Did you have any policy changes this month? Did you work with your school staff on any procedure changes, or look at the school policies on anything related to RPE? So that collects that kind of data. On the bottom right, that's the RPE participant quantitative outcomes. Those are the pre-post surveys that we implement with the primary groups that they work with. And then lastly, this is a continuation of the last slide, but we do collect some process outcomes on what they're doing, like as far as what activities that they're implementing in the community and in the schools, like how many, this is where you get the counts, like of like how many people did you reach, how many people are in your regular groups that you meet with after school or in the classroom, what did you do with them, that kind of thing.
Okay, so this slide is just kind of summarizing some of the main adaptations that we made to the data collection system in year 2 and year 3. And I'll go through this quickly because I think Mina touched on these already. But in year 2, because of COVID-19, we made pre-post survey data collection optional. We also made process data collection optional. We're really trying to make sure that everybody was able to focus on just getting through that time and showing up for youth and providing safe spaces for them. The focus was not on data collection. And that is when we introduced these qualitative questions, which we ended up keeping because they provided such great context to all the data that we were collecting. And then in year 3, we ended up we had self-generated ID codes that we had on the surveys to be able to match pre-survey to post-survey. And in reality, that wasn't working very well with middle school and high school students. They would skip some of those questions and the pre-post matching wasn't working and it was taking a long time to explain it. So that was removed. We combined the community level outcomes form and the process form. And we revised and shortened the participant surveys and shortened the process form. So we were really trying to take feedback from what we were hearing from RPE facilitators, trying to streamline the system and make it as easy as possible to collect this data.
Yeah, and I wanted to talk a little bit about the triangulation of the data that we use, because we in addition to using this primary data collection from that we collect from RPE participants and from the RPE grantees, we also looked at the public data, and we have a few different data sources in California that we use. I know you are probably all familiar with the BRFSS, the Behavioral Risk Factor Surveillance System, since that's a CDC survey, and a lot of states do that around the country. As for also the Youth Risk Behavior Survey, and that's a national survey. We also in California have the California Healthy Kids Survey, which is similar to the YRBS, but it's very adaptable. There's different modules that can be implemented, and we use that data quite a bit as well. The UCR on the top left is the Uniform Crime Report. So I know a lot of you also use that data for criminal justice data that we use for just the reporting to the criminal justice organizations in the state. There's also kids data here on the bottom here. That's a website that aggregates a lot of data about children around in California. So that includes data like the Healthy Kids Survey and the YRBS, as far as other data sources as well.
All right. So over these last 5 years, we are now taking a moment to reflect on the implementation, the design, piloting, and implementation of this RPE evaluation system in California. This has been the first ever standardized California state level RPE evaluation system over the last 4 years. And it has been a really amazing learning opportunity and a major accomplishment to implement across these 24 subgrantees. And because we were flexible in the design of the system and because we had to be, right? COVID-19, the context of what was going on in the world and in the state of California kind of forced us into this state of flexibility, which actually I think has really helped us to be responsive to feedback and able to kind of tweak things as we go along to be continuously improving and learning, to keep working towards a system that really works for the researchers, but works most importantly for the people on the ground doing the work, isn't overburdening and giving, making extra work for them. So we have kind of in that reflection come up with a list of benefits of this RP evaluation system and challenges that we are continuing to work on and explore and think about as we move forward into this next phase of the implementation. And so some of the benefits that we've identified are that continuous data collection allows for continuous evaluation and learning. Touched on that a minute ago. The ability to kind of act on what we're seeing in the data month to month and year to year. We now have the ability to look at RPE data over time, which is really exciting, and we're excited to continue to build that data up over the years. We are able to collect data and analyze it across 2 levels of the social ecology, so the individual level and the community level. This kind of process of collecting this data over the last 4 years has also allowed for annual dissemination of individual and aggregate reports to CDPH and to grantees. So once a year, UC San Diego works to compile this data and analyze it, and then we do a webinar to share it back with everybody and have that moment of like, congratulations, you guys made it through a year, here's your data, let's talk about it, and let's figure out what to do moving forward. Which has been a really nice moment on our side to get to connect with people and hear about how it's working in the real world. As Mina was just talking about, it allows us to triangulate this RP program data that we're collecting continuously with all these amazing public data sources that we have in California. And it has also facilitated a statewide understanding of the progress that we're making towards these goals and where we can improve. And yeah, just big props to the RPE facilitators who are collecting this data and entering it on a month-to-month basis. They are the life and soul of RPE and also of the RPE evaluation system. So challenges that we've identified that we're working on and thinking about fall into 2 different buckets. We have contextual challenges, as we've talked about, COVID-19's impact on RPE projects, on schools, on communities, on RPE program staff, on youth, the social and emotional impact of isolation and having to be in and out of school. It was a really tough time, and so a really tough time to be implementing programming and a really tough time to be collecting data for lots of reasons, but high turnover in schools related to all of this context often led to inconsistent data, gaps in data, the quality of the data sometimes wasn't great just because people were trying to get through the tough time. And also high turnover at the local subgrantee organization level. The system took a good amount of training and communication and how to use it. And so when turnover happened and we weren't able to catch it in real time, there were sometimes gaps in knowledge that kind of would slip under the radar, and then we'd have a little bit of a gap in data. And then technical challenges that we're still working on. As we've alluded to, this system, the burden of this system rests heavily on the RPE facilitators and the participants because they are the ones collecting the data. We also had some pretty big issues in matching pre and post surveys. I think mentioned earlier, we did have self-identifiers on the surveys that we tried out for a while and it was really not working. And then we tried to do demographic matching, which also has proved to be a little bit difficult just because a lot of the groups are really similar demographically. So that's something we're still working on and thinking about how to continue on. And then finally, high ceiling effects in our survey measures. And this is something in sexual violence, dating violence outcomes research that is like something our field is kind of grappling with. And what we mean by that high ceiling effect is that at pre-survey, before taking the program, participating in the RPE program, youth were answering in really positive directions and what we would want to see. So it becomes really difficult to then evaluate change over time, evaluate change for the RPE program as a result of the RPE program. All right. Anything to add to that, Mina?
No, I was just going to say that I think we tried to address those high ceiling effects with those changes in the surveys, and I think they did end up being, better because I think one of the changes was sort of concentrating on those questions, which it did also address making the survey shorter, which everyone was also asking for, but also sort of not concentrating on those questions that did not have as high ceiling effects. So we tried to, address both those issues with the changes in the surveys.
All right. So now we're going to move into talking about some of the results of the evaluation system, and we're really excited to center the community level results here. I will just show this table quickly. I know it's not the most fun thing to look at, but just to highlight that because of the way we've collected data, especially with our community level data, we have all these indicators of community level change as a result of RPE programming. And so each year across these 3 years, we're able to kind of track and look at the fluctuations. Oops, sorry about that. So what this means is that 20%, if you're looking at 2019, 2020, 20% of the RPE projects that year reported that they'd changed a school or local policy or protocol to help reduce sexual violence and harassment in the community. And so we're excited for over time to be able to kind of track these different indicators. And the way we've built the system, in the process community outcomes form, there's always an option to enter narrative data, to enter qualitative data to give us some context about why we're seeing these fluctuations, why, some of these, when you're looking at it, maybe don't make sense. But if you take the COVID-19 context and burnout into account, 2021, 22 was kind of when all that really hit as people had gotten through it and were starting to come out of that crisis mode and feel really burnt out. And so that might explain some of these drops that we're seeing. Okay, and we're gonna now move forward in the presentation to give a spotlight.
Hi, everyone.
Community orgs. So I will pass it to Anna, who's gonna present virtually.
Hi, everyone. My name is Anna, and I am the Prevention Program Manager at Center for the Pacific Asian Family, or CPAF for short, and we are a school-based RPE grantee. Really quick, for context, CPAF is a dual domestic violence and sexual assault agency that provides culturally and linguistically responsive services for the Asian and Pacific Islander community in Los Angeles County. This means that our prevention programs and outreach efforts also focus on engaging the API community and not just our direct services. The student body of our school is majority API at 55%, with Hispanic or Latinx being the next biggest group at 40%. So it's almost half and half API and Hispanic Latinx, but more API. Some snacks that our youth have requested in the past include high chews and chili-covered lollipops. And our role play scenarios might include something like parents expressing their love through a plate of fruit that they peeled and sliced for you, and never expressing their love verbally, just to give you an idea of the context of our work on a personal level. Our vision is seeing Asian and Pacific Islander communities embracing and practicing healthy relationships, as well as working in partnership across communities with other communities to eradicate all forms of violence. So working within the API cultural context, that means to recognize norms within API cultures that address the cultural nuances of how healthy relationships are defined and modeled. And at the same time, that means working with non-API communities to build partnership and allyship for the shared goal of strengthening our relationship skills to reduce the occurrence of relationship and societal violence. One way we use the survey tool is to start meaningful dialogues with youth participants. We distributed the survey by going through the questions section by section to help support a shared understanding of the questions. But after everyone submitted their responses and after we went through all the questions one by one together, I didn't really feel good. The mood and the vibe in the classroom wasn't good, so I opened up an opportunity to check in with them. I asked them, how did it feel to take the survey and what did it make them think about? And they shared that the questions made them feel disheartened and disappointed with the school admin. The teacher of the classroom also felt really angered and only added to his already big disappointment and frustration with the school admin not caring, at least according to his perception. They really feel like the admin don't care. And then the teacher turned to the class and said, Anna's going to help us make changes at the school and get the admin to do differently. And then he turned to me and was like, right? And I felt really put on the spot and pressured, and I knew I couldn't guarantee a change. But I responded emphasizing that we're working in partnership with admin and hope to be a bridge between admin and students. But my subtext there was that this is not a you versus them issue, and I don't want to make it that way or pick a side or point fingers at, who's responsible or who should be doing what, but really trying to foster a belief that, everyone, all of us want a healthy and safe school climate with respectful relationships between the students and teachers, between the students and admin, and between teachers and admin. And so we really need to work in partnership with all the parties to work collaboratively toward making positive change. So administering this post-survey really sparked this dialogue, which helped me learn about the needs of the students and this teacher to feel supported by the admin. And that informed our approach to continue identifying opportunities to create more understanding and opportunities to build trust between students and admin. One way we used the pre-post survey results and the data was to increase buy-in from the school admin. Having data really helps legitimize and give more credibility to our prevention efforts on campus. Data just grabs their attention because schools are always administering their own surveys and assessing their own data too. So having the data there encourages them to see us as a valuable partner and value our suggestions and involvement. And the data points and key findings allow for them to have a better understanding of what prevention work is and what it actually looks like. Like, what are we doing on their campus? We use the data points as a communication tool with the school staff to inform our partnership work moving forward, which means we inform the way we continue working towards our goals and outcomes on campus, like what makes sense now that we know this data, what makes sense for our strategies and approaches moving forward, what are the appropriate avenues and channels at the school to work with and navigate for the next year? Do we need to make small adjustments or modifications, or what did we learn from the data? We want to use our learnings from this data to implement responsive strategies, and then that will increase the likelihood and effectiveness of reaching our desired goals and outcomes. During the spring of 2023, so earlier this year, we approached UCSD Center on Gender, Equity, and Health to see if they could help us prepare a pre-post survey data analysis so that we could take the findings to the school to advocate for more school buy-in and for them to see us as a valuable partner, like I mentioned earlier. UCSD pooled the data from September 2021 to March 2023. So that's 2 academic years worth, which means 2 of our RPE group cohorts of classroom-based prevention workshops. The reason why we didn't use more data before 2021 is because the pre-post survey was updated and modified. And so UCSD wanted to look only at the data from the newer version for consistency. Also, data collection during COVID was a mess. It was really incomplete. It had too many gaps and not enough data for meaningful analysis. So analyzing the data for the last 2 years made more sense since students also returned to school in person in 2021. So the data would be more reliable as well. UCSD also cleaned the data, which is a long process. They matched survey responses by demographic characteristics, and then they analyzed the data to look at what were the changes and key outcomes between the pre and post survey. So thank you, UCSD. I'm running out of time a little bit, so I'm going to try to go through this quickly, but I wanted to share the findings that we ended up sharing with our school admin at the end of the year check-in meeting. We had an end of the year check-in meeting in May earlier this year, so we worked with UCSD in the month of April for them to clean and analyze the data, and we made it in time for our May meeting with the admin. And we found that after RPE project exposure, our RPE participants showed increase in reporting that their peers would intervene, that they thought their peers would intervene if their peers saw or heard someone telling sexual jokes that disrespect LGBTQ plus people, saw or heard someone doing unwelcome or uninvited sexual things towards a person, or saw or heard someone showing sexual messages or naked sexual photos of a dating romantic partner. So like examples of sexual violence. This was our strongest finding, that there was an increase in strengthening social norms that help prevention efforts, or social norms that protect against dating violence, sexual violence. There was also noticeable increase in bystander intent and behavior. So after RPE project exposure, CPAF, our RPE participants showed increase in the participants saying that they would act if they saw or heard about a friend showing sexual messages or naked sexual photos of a dating or romantic partner. And they also reported that they would, or they did, take positive action when they saw or heard someone doing unwelcome or uninvited sexual things towards the person. So there was a showed increase in like the attitudes towards intervening as a bystander, and there was an increase in that they actually did some bystander behavior. The last key finding is about perceived school support, and this was the most interesting and important finding for us to share with admin. We saw that there was an increase in both agreement and disagreement of RPE participants thinking teachers and staff response to sexual violence was supportive or helpful. And there was an increase in the number of RPE participants who felt indifferent at the end of the school year about whether or not teachers and staff were communicating clearly about sexual violence not being okay and something that the school will not tolerate, as well as more students feeling indifferent about teachers and staff doing enough to make physical spaces on campus safer. So basically, there is a mixed response in respondents feeling that the actions taken by teachers and staff were adequate. So those were all the 3 findings that we shared with the admin. And their reactions to it, when we shared the data, there weren't any notable reactions to the data that we shared. But student survey responses aren't new to school admin staff since they do data collection all the time. And in the past, I remember hearing an admin say, there will always be students who aren't happy with how admin handles things. So with the data showing that there was an increase in dissatisfaction of admin and teacher support with regards to responding to sexual violence, it probably didn't come as a surprise to admin. I can't say for sure why there was a mixed response in some students believing more in admin support by the end of the school year, others believing less, and still others feeling more indifferent. But it makes sense to me that some students would build positive relationships with teachers and staff throughout the school year, and others would have negative experiences with teachers and staff throughout the school year with issues including but not limited to sexual violence and harassment on campus. Which is why we really want to work with the school to bridge the gap of understanding and trust between admin and students and strengthen their relationships by providing spaces where students can feel heard and admin can prove and demonstrate how they are responsive to student feedback so that the students can build their trust in admin. So the data really supported justification for what activities we should invest in moving forward with the school. The admin team and our main admin partner showed high interest in having CPAF conduct a trauma-informed training for the teachers. So that's something we're working on putting together now. And she said to us that CPAF has credibility working with San Gabriel High School since we've been there for the last 4 to 5 years. And so instead of this training being admin driven, they want CPAF to be the ones to share what the students have shared with us, what we've heard from the students while working with them, so that we can approach this problem of like classroom management and like teacher stress and teacher student ill relations. So we can approach that with the information that we have about the students' needs. A second activity would be that CPAF will be following up with the admin and teachers this year to support a potential student-driven youth leadership space called the Plus Club, which is something that is being given by the district. And so for CPAF, we're moving away from classroom-based workshops this year to club-based cohorts to reach a wider, more diverse audience of the school. And the school's intention with the Plus Club is to help get a finger on the pulse of campus. So participants will be students who have leadership presence within their own biospheres, whether that leadership is formal leadership or not. And admin want to convey messages to as many little groups of students as possible, and that way build school spirit so that the students are excited to be at school and so that the students foster more connection with the school community. So we'll see how things go this year. Thank you so much for your time and grace, since I know I took up a lot more time than planned.
Thank you, Anna. Here in spirit.
All right, hey y'all, I'm in person, unlike Anna. Just kidding. Once again, my name is Alina Mendoza and I use they, she pronouns. And I am a community educator in the Sacramento Unified School District. I am embedded in an elementary school, a middle school, and in a high school. Today, we're going to be talking specifically about our middle school programming. I am new in this role. I have just passed my 1-year anniversary working in this position. Yes, I love this job. But we're going to be focusing on my data, as Weave has had the RPE grant for the past 5 years. I just didn't feel comfortable talking about someone else's amazing work, so I wanted to just specifically talk about my work the last year. So just for a little background on those of you that may not know Weave as an organization, we are Sacramento's primary dual agency for domestic violence and sexual assault survivors. Our main mission is to promote safe and healthy relationships and to support survivors of sexual assault, domestic violence, and sex trafficking. And most importantly, we rebranded to really promote that our agency supports folks of all relationships, all genders, all ages, all people, all the time, right? So our number one mantra that I love to teach with the students is when everyone acts, violence ends. So that's their main message that they're getting with each interaction and each programming that they attend. Oops. So I wanted to just bring you in a day at the life at Wilsey Wood Middle, the school we're going to be focusing the data on. So like I mentioned, I'm their embedded educator and confidential advocate. So my role looks like doing in-classroom programming, hosting during lunch and after school programming, and also being there for that one-on-one advocacy for if a student is in a classroom lesson and they're reminded of their personal experiences or something of someone else in their family, their support systems, they're able to come to me and know that they have a confidential space to process, to know that they're believed, to get that support, and to later, if they want to, reporting options. So just some content on what our RPE curriculum looks like. We're doing age-appropriate and dynamic conversations about everything that's listed up on this board behind me. We have conversations about affirmative consent, healthy versus unhealthy relationships, and online safety and sex trafficking, just to name a few. And of course, I love to put up what my students do. So that was one activity where we did group lessons on all about consent, the healing and supportive messages that they create in club. And then, of course, we have our youth activists that I really push and motivate to run tabling events on campus to really spread that peer education and conversation from a youth perspective. So let's go ahead and start talking about that data. We used our data in 2 different ways. So it really provided some context for understanding the direction and the needs of our students, what they needed on campus, how they needed someone to show up and be there for them, to uplift their voices, what's needed in their campus climate. And it also really helped inform our services and how we're going to show up and be there. So to talk a little bit more, let's go into depth of what that context for understanding the need for student direction support looked like. So first and foremost, the RPE surveys really highlighted what the campus climate was like. Earlier, Emma talked about that high ceiling effect happening in pre-surveys, where students were coming on campus, they're super excited, their first year fully in person, coming back to being with their fellow peers, to interacting with teachers, staff, admin. And then they reported very positive impacts in the beginning. But then as they started to make a presence on campus, start to interact with staff and faculty, they kind of got a different expectation than what they were expecting to come on campus and see. So we got to see that our students really shared that we need certain types. Whoa, is this going on its own? Sorry. But yes, like I mentioned, so we really got to be able to understand what student experience was like from their perspective. And most importantly, something I loved to do was after we did those surveys, for the students that were coming in to access one-on-one support, I used the understanding from the surveys in connection with building that trust from our students, because they got to discuss more in our one-on-one advocacy the kind of climate that they were experiencing on campus. They were pointing out the challengers on campus. Who were those adults that were modeling unhealthy behaviors, that were building that distrust with students, and really got to highlight and understand what that looked like from their perspective. And then secondly, being able to inform services in our presence on campus. Just me as a person, I never like to go into a space assuming I know all, I'm the one that's got it all, right? Especially working with youth, I create those needed spaces. I'm super intentional with my work, and I try as much as I can to uplift their voices and to center themselves in the curriculum in our presence on campus. And so being with them and these surveys really informed what topics and services we needed to highlight more than others. And of course, that doesn't mean we only did a few. We talked about everything together, right? But it really informed which ones needed to be facilitator focused or which ones could be youth led. Which ones were able to give our youth that spot to shine their activism, to do that peer-on-peer education. And then, of course, like Anna mentioned in hers as well, the findings really highlighted a need for this curriculum for faculty and staff as well. Especially on my middle school campus, we have a predominant campus climate of students of color with white faculty members, admin, staff. And already that power dynamic of just adult to student, when you add ethnicity, race, religion on top of that, we started to see a lot of adultism on our campus. And especially with my one-on-one advocacies with my students, they were sharing those sentiments. And we saw that in our data. So to start talking about those numbers, like I mentioned, we have had this grant for a while. So we've been doing a lot of pre-surveys. We have a total of 1,263 pre and post surveys from 17 RPE groups. But for today, we're solely going to be talking about 2 8th grade classrooms that I got to do weekly lessons with for the past school year. And so we're going to be talking about those 97 surveys that we got there. So from our 8th grade 2 classrooms, we saw a few things, but just some context. Like Emma mentioned with those high ceiling effects in the very beginning of surveys, our data did not have statistic significance to prove that our RPE curriculum was the reasoning behind these things that we're talking about today. So with some context that I'll provide while we're talking today, just wanted to give you all that little heads up before we get into it. So we saw some increases in our participants reporting that they agreed that school staff responded in supportive and helpful ways to incidents of sexual harassment and sexual assault. And they also reported higher levels of confidence that they would intervene as a bystander if they saw or heard peers being mistreated. And for that second point, there's just some few examples I can touch on of even with their engagement in classroom lessons, when they're tabling on campus, when I was walking through the halls, I heard them using the language they were giving through the RPE education. They were telling students, hey, that's not okay to say that, or you shouldn't comment on the way that person looks. You started to see them use their bystander skills that they were given, and it was just something that made me so proud each time I walked on campus. So for some other things that we saw, on the flip side of those increases, we also saw decreases in agreement that school staff said things to make it clear that sexual harassment and sexual assault is not tolerated. We saw a decrease in agreement that teachers at school worked to make safe spaces on campus. And lastly, a decrease in agreement that they felt connected and comfortable with others in their community. So like I mentioned, with that high ceiling impact in the very beginning with their pre-surveys, where they're excited, they're ready to come into their school, they're ready to engage with others, and then they start getting this RPE education. And then they start learning more about how this might be showing up in school. Maybe seeing those specific challengers on campus, use language that is unhealthy, right? Microaggressions, pointing out certain students on campus aren't allowed to do things because of who they are, how they look, right? We saw a lot of that happening on campus, and it really just highlights that context of they came to school super excited, and then they started to learn, okay, actually, there's some improvements that can happen on campus, right? There's some ways that we can spread this awareness and really highlight that the need for this kind of education. So with all of this that we found out from our interactions with our students, the highlight of adultism taking place, where they were dismissing of experiences, kind of that narrative that, oh, it just happens, you're too young to understand what's going on. Weave has found these findings to allude that there's that need for trauma-informed care for our teachers and staff, for our educators. We need to promote that safe and emotional learning for the staff as much as we're reporting it for our youth, right? It's really sad and disheartening when we give those skills to our youth, but we have models that are not displaying that as well. So some context as to why we found that important is our students really just highlighted who those challenges are on campus. And then what's really amazing about my middle school is it feeds into my high school. So the students that I have interacted with, I'm able to use their data to translate from my RPE middle school to my high school level. And then, like I mentioned, that long-going limitation was that positive impact on the pre-surveys. So as Weave, as an organization, something we're doing next is really increasing the trainings for staff and caregivers as we do for our youth. And then we're also trying to uplift our youth activists and leaders on campus. Sorry, my brain just completely blanked right there. We're trying to uplift our youth activists and leaders on campus to start creating groups where they lead the policy change that our organization is wanting to do on their campus. Like I mentioned, centering what the community needs, what our youth needs, and having them be the forefront of that advocacy and what they need in their school. And lastly, continuing to create that trust with our students to empower them to uplift their voices and to really center their support at all of the work we do. So thank you so much for having me, and I really appreciate y'all.
Thank you, Alina. That was awesome. So cool to get to hear from both Anna and Alina about how this data evaluation system is working on the ground.
To wrap up, I really want to talk about the future of RPE evaluation here in California now. And I know we've talked about addressing risk protective factors. I think one thing that we have talked a lot about in the last few years is looking more at those shared risk and protective factors. And something that we are developing to get at that is a data dashboard. And we want this data dashboard to really promote looking at data that relates to health equity. And those data are those data that are related more to social terms of health, root causes of violence, health inequities to prevent sexual violence and violence in general as well. So we know that this RP evaluation, for this RP evaluation, we want to understand the impact at the community level, and for that we want to look at those indicators that address the community risk and protective factors. So this data dashboard is something that we've been working on with UC San Diego, and also UC Berkeley. Emma right now is kind of in transition in between Berkeley and UC San Diego. So we wanted to create an online accessible data dashboard for California and also available to anyone actually that brings about 20 public and private data sources related to gender-based violence and violence prevention. So it's currently in development. We plan on releasing the sort of first incarnation of this on the 15th of September. So it's on its way soon, not ready in time for this presentation, unfortunately, but it's in development. And the data sources are really around 5 different broad categories: child and youth development, economic security, leadership for women, girls, and non-binary people, community leadership engagement, and protective environments. So we identified these 5 areas through a strategic planning process that we underwent within our violence prevention programs. And then Emma is passing along a sign-up sheet. If you would like to find out more about this data dashboard, when it's done, we'll go ahead and send you the link to it. If you want to write your name down, we'll go ahead and send you that data dashboard link out when it's ready to be sent out. With that, I think we're done for today. I do want to put our website up here. I know you might not want to copy that huge CDPH link down, but this is our website. This is where we also have our things like our data briefs that we developed for RPE. This is sort of a summary on a state level of the data, some of the data like that Alina and Anna were talking about from their local organizations, but we kind of compile it. And we have a few data briefs up there that you can look at as well. So again, thank you to Anna and Alina too. And thank you to our other team members. Enrica is our RP coordinator right over here. And our other UCSD Gender Equity and Health partners, Sabrina, Jay, and Ricardo. And this is our contact information if you would like it as well. Thank you.
Thank you.